Well, today we're talking about a topic so many people are curious about right now, GLP-1 medications.
You know the big names like Ozempic and Wegovy and Zepbound. They have completely changed the conversation around weight loss and diabetes, helping many people lose 10 to 25% of their body weight, like celebs Meghan Trainor, Whoopi Goldberg, Oprah, Serena Williams, but also everyday people too, as they have become more widely available.
Yeah, that's right. And now new research suggests these medications might even play a role in reducing certain addictive behaviors. But with all the excitement, there are also important questions about things like bone density, stomach issues, and some rare complications.
So this Wellness Wednesday, we are breaking down what's fact, what's hype, and what people really need to know with Dr. Natalie Gentile, co-founder of Direct Care Physicians of Pittsburgh and founder of Rebel Wellness. This is a really important conversation because I think that we've learned a lot over the last couple of years as we've seen these kind of become oversaturated in the market. So what do we know now about them?
This has been a fascinating time in our careers as physicians, right? Learning about these GLP-1 medications and the ways that they are helping people so substantially. We know that in the beginning, these were for diabetics, right? These medications, we know that they're helpful for our diabetic patients, but it turns out they also can be helpful from a weight loss perspective. But I think most people think of them now just as a weight loss med.
Right.
You know, we are seeing that these medications are so helpful beyond just weight loss and diabetes. Sleep apnea, heart disease risk reduction, helping people with addictive behaviors. We're starting to see that as a potential, extra benefit. And I'm also seeing a lot of reduction in inflammation and pain in my patients that have things like rheumatoid arthritis, my patients with PCOS. So it's like every day we're seeing something new in clinical practice that they're benefiting.
Yeah, so we know that there are so many benefits, and this conversation is so timely for me because I have been seeing so many marketing ads and campaigns that are targeted to young people, young women who aren't necessarily overweight. And I think it's all being influenced by Hollywood culture because we're seeing it everywhere over there.
Yeah, this is basically something I'm hearing from patients about every single day because they see friends, people in the media. It's constant. I think it's important to do the step back that we like to do on Wellness Wednesday, which is like how much of this is targeting of vulnerable populations and how much of this is actually people who need these medications.
Well, it's so funny because in some of the comments, we will criticize women if they are a weight that we don't deem to be okay, and then we will criticize them if they lose too much weight. Yes. And so we kind of have to shut that noise off. And you've even talked to us, I think when we were just starting to see these come into the market for mainstream, step back and say, why do I want to lose this weight? Really have that conversation with yourself.
Certainly.
I know that you were just reading over some new information. I mean, we are seeing some like bizarre things come up with this, like even our palate's changing a little bit when it comes to GLP-1s.
Yeah, we've talked in the past about how these meds impact food noise, for example, so that obsessive conversation in your head about eating. It also, in some patients, they notice that their tastes different, And also, I think it's a shift to the foods that they're choosing. If you start to really prioritize more, let's call them nutrient-dense or healthful foods, they may not be as palatable out of the gate as fast food, right? So this is changing the market of things like spices and, hot sauces and certain foods that are at restaurants because the market has to adjust to what such a big impact has been with these GLP-1s.
Well, we were just talking about protein being added to everything. I saw it, Starbucks has added protein to some of their drinks as well. I mean, it's
everywhere. Protein,
everything.
water.
Yeah.
And I think because GLP-1s and that conversation, it's taking over everywhere. We're almost forgetting about the benefits of hormone replacement. So we're talking about progesterone and estrogen and how those can tie back to weight loss as well.
Yeah. So I have a big perimenopausal and menopausal population of patients, for example, and we're having this conversation regularly as the metabolic syndrome of that age range happens. Adjustments in your blood sugar, increase in insulin resistance, right? Higher cholesterol, your heart disease risk going up. And so these patients are saying, hey, I've got these changes happening in my body. Should I be taking a GLP-1? But we do know that hormone replacement therapy is the main priority there, and that in a discussion you should have with your doctor. And then GLP-1s can be a nice adjunct to that. So I think it's important we not forget kind of back to the basics in that patient population.
Because I know for a lot of women, they really struggle with weight and weight gain as they enter into those perimenopausal years.
And let's not forget about the loss of muscle mass that can happen with these medications, right? That's a major thing. Of impacting our bone density. And those are big things we see in the perimenopausal and menopausal years.
I'm glad that, we're talking about all of this, but I want to also touch on some of the things that may be kind of the negative side effects that could come along with this. How rare are some of these things that we're seeing?
So most of the time, the thing I'm seeing most commonly is nausea, right? Because people get full so quickly. That's not a side effect of the med. That's the med doing its job, right? It's supposed to make you feel full quickly, which can cause maybe some GI upset. And so I see that very frequently. But another thing is that skeletal muscle mass loss. That is an impact from these GLP-1s, and that is commonly happening. Patients need to be working with a dietitian, regularly doing resistance training and exercise. Just because you're losing weight doesn't mean you are getting healthier, globally. So it's important that we maintain that muscle mass to protect our bones in the long run.
Yeah, and let's go back to, just for a moment, this effect that Hollywood culture is having on young women. I mean, what is that conversation that you're having? And I don't know if you're seeing this, like younger and younger women coming in and wanting these medications who might not even be overweight. How do you start that conversation?
Well, let's remember that these medications were studied in diabetic and obese populations, not in the person who needs to lose 5 pounds and doesn't have any of those conditions.
Right.
So from a safety perspective, now we're getting into a territory of we don't really have the data to support that. Right. And you have to ask the bigger question, which you did, Mikey, of why? Why are you wanting to fit this certain body size and shape? Because I think I see a lot with these meds is they can increase the disordered eating thoughts that we have, right? There's this insatiable need to be thinner, thinner, thinner. And when you are using a medication that helps you with that, that train leaves the station, and for some people it goes too far.
The messaging, I think, all of it is just so interesting between all the protein we're seeing added and everything and the commercials. I mean, we're seeing constant commercials about weight loss. It's a good reminder to me to have this conversation with my own girls about why we're seeing this and why having a healthy outlook on your own body is so important.
Absolutely.
I mean, really serious stuff. Thank you so much.
Thank you. All right, if you're interested in learning more about Direct Care Physicians of Pittsburgh or Rebel Wellness, head to our website, kdka.com/talkpittsburgh.